No matter how bad Maris Burton's back and neck pain got, he still wanted to go fishing.
I've had times when I didn't go on some fishing trips or eliminate some winter fishing trips because of the pain. Sometimes I hurt so bad I just can't go out and put myself through it. But I absolutely try not to let my pain stop me from living my life.
Burton has lived with chronic pain for 38 years, ever since he hurt his back at work lifting a box.
The doctor I was seeing just kept giving me stronger pain medication. And at one point they had me taking morphine, which just kind of left me where it was hard for me to work because I couldn't focus on things clearly. And then one day I was in there and trying to explain to her that it wasn't really working, that I needed to try to get a more reality-based thing in my life for my, to deal with my pain. And she just stood there and looked at me and said, "Well, I don't know what to do for you."
Are you playing golf or tennis or anything?
Burton realized that he needed to take charge of his own health. The first thing he did was find a new doctor, and together they came up with some new strategies, which included losing weight, cutting back on pain medication, and eventually having neck surgery.
Once I could start stretching my neck and start moving, I started trying to walk. I could walk half a block and rest. And I kept doing that consistently every day. And about 6 weeks after my surgery, I was walking a couple miles, and I gradually worked that up to where I walk 5 or 6 miles almost every day.
Burton's doctor thought other people could learn from his experience, so he recommended Burton become part of a research team studying chronic pain.
My initial reaction was, sure, maybe I can learn something about strategies for pain management from other people. And I thought I had some pretty good strategies for managing my pain that maybe I could share.
Clinicians and researchers haven't always involved patients, and it's important when we're trying to improve their lives for things that are important to them that we involve them from the beginning to the end.
The team included other patients with chronic pain, patient advocates, clinicians, and researchers.
The original goal of the study was to use a standardized assessment tool with doctors and patients to see how it worked and to see if it resulted in better patient outcomes.
This is the original tool, or form. It asked patients to rate their symptoms and activity level using a number value, from as good as it could be to as bad as it could be.
We thought it would be easier for the patients if they had space to write out whether they were getting better or worse, rather than being limited by just numbers without explanation or any modification.
So the patient stakeholders created this new form with a place for patients to write about their ability to do specific activities and to describe what it would be like if that ability got better or worse. One of artist Barbara Black's favorite activities is painting, but chronic pain used to keep her from climbing the stairs to get to her studio.
Well, sometimes I'd drive up and park, and then I'd realize that I simply wasn't up to going up all the stairs. So I'd sit there for a while and try to talk myself into it, but I just wasn't able to do it. So I would drive away and go home defeated.
Having patients on the study team led to a more patient-friendly form, but it was also valuable to doctors in two different ways. First, it helped them to understand what was most important to their patients.
A second thing that the form has really helped me with has been to focus our attention in these conversations on improving function. So if we're treating a patient with chronic pain, even if we improve the pain, if the patient can't do the things that are important to him or her, we haven't made the progress we need to make.
Researchers say the only way to learn these valuable lessons is to involve patients as equal partners in the research.
It was really valuable having patients involved in the implementation of this study. After all, when we take care of patients as clinicians, when we do research, ultimately we're doing this for the patients. And if the patients aren't involved hands-on, then we're likely to make assumptions that aren't accurate.
Maris Burton was happy to provide the team with a patient perspective, But he also applied what he learned during the study to his own treatment.
I think the conversation with doctors should really be about functionality and what you can do physically in your life. But I believe it's really imperative that patients step up and take charge of what they're doing. It's their responsibility to take care of themselves. The doctor can assist them with that, but he can't fix them.
On most days, Burton still has pain, but he's learned how to manage it. And as long as he can fish and play with his grandkids, he considers that a success.